department at Diversity, Equity, and Inclusion Grand Round. So we're excited today. We have a great speaker with us. We have Dr. Jodie Guest. She's a professor and senior vice chair for the Department of Epidemiology at the Rollins School of Public Health, co-director of the Office of Interprofessional Education and Collaborative Practice at the Woodruff Health Sciences Center. They're doing a lot of cool new things there, I know. And then the associate program director for the physician assistant program at the School of Medicine at Emory. She's been the recipient of multiple awards. This was a lot of fun to read about the recognition she's gotten. So most recently, 2022 Distinguished Lifetime Achievement Alumni Award from the Rollins School of Public Health, the 2022 and 2020 Rollins School of Public Health Professor of the Year, and then 2019 Emory School of Medicine Excellence in Diversity and Inclusion Award. Also 2023 was awarded the Society for Epidemiologic Research Kenneth Rothman Career Achievement winner. In a slightly different vein, something I want to talk to her more about another time, she's also in the Leadership Council for Zoo Atlanta, so that sounds like a lot of fun. She has a broad background in epidemiology and specific expertise in racial, sexual, and gender minority populations in HIV care, large cohorts, and emergency preparedness. And her work centers on communities with inequitable access, stigma, and systemic barriers to care. You know, in a lot of those veins, I think a lot of those come together: the interprofessional nature, the limited access to care, the kind of serving the community. I think that comes together in her role as the director of the Emory Farmworker Project, which is a multidisciplinary program that provides healthcare to thousands of migrant farm workers each year. I've had the opportunity to go. It's a really unique experience, really rewarding experience, and so excited to hear more about providing healthcare to migrant workers here today. So thanks for being with us, Dr. Guest.
Absolutely. Thank you so much, Dr. Smith, for that introduction, and really appreciate the invitation to be with you all today. So I am going to be talking about the Emory Farmworker Project and what it is and what we do and how we it's got multiple prongs of what we try to do while we are there and present that to you, all with the vein of really trying to show you the diversity of both what we do and who we serve and how we serve, and speak about some of the inequities which we see that are quite pervasive in this population that we have really the privilege to help care for while we are there. So I'm going to share some slides with you. All right. Are you all able to see those?
Yes. Oh, there we go.
Okay. Okay, great. So the Emory Farmworker Project actually has had another name in its previous life. It was called the South Georgia Farmworker Health Project, and we shortened it about 6 years ago to the Emory Farmworker Project, and this is our logo here. And so I'm going to start with who are the farm workers in the United States. I think that there's a very large lack of knowledge about who is included in this and who they are and what they do, and a lot of assumption about this population. So we're going to talk through a little bit of that at the beginning. From a diversity perspective, the populations that we see in South Georgia, and we go to two different locations, Bainbridge and Valdosta, they are both about 3.5 to 4 hours south of Atlanta, and actually a bit different in the populations and the crops and the work that is being done there. But from a diversity perspective, we see people primarily from the countries of Mexico, Haiti, and Guatemala. We see some people who've been in the United States for a very long period of time, and some who have only been in the United States for one particular picking season. We see people who go back and forth from their home country to the United States, and some that this is where they reside. We also see diversity in H-2A workers and those who do not have H-2A worker status. That has a really big difference on the some of the things that are offered to them or required to be provided to them in their job and employment in farms. But we are very careful to not ask about status, because we don't want at any point in time our our being there and the work that we are trying to do to be a hindrance, and we do not want to put anyone in jeopardy while we're there as well. We also see, and this has changed a bit over the past 28 years, a increasing number of people who actually are fairly stationary in living in the communities that we are down there a couple times a year, versus the number who are still migratory. And if you do work as a migrant farm worker or migrant picker, both terms that are used commonly, it's a typical season of moving every 6 weeks. And so there's a very big diversity in those that live there full year round versus those who are moving very, very regularly. I think one of the commonalities that, regardless of the country of origin, regardless of whether or not they live in the United States and consider this their home at this point, whether or not they're H-2A workers or not, and whether or not they migrate or don't, what we do see very, very commonly is that these communities are incredibly underappreciated and commonly just not seen or ignored in the communities that they live in. And so that is a very consistent theme, and is something that we talk a lot about with the students while we're preparing to go down there, and discuss with them when we come back as well, because that can be a very startling thing to see how this group of people are really not supported in their local communities. A little bit of background about the U.S. migrant streams. If you only think about H-2A guest workers, which are workers that have guest visas, we see that there are 3 primary streams. There are actually 7, but 3 primary streams of workers in the United States, and where they travel to in order to be in the right places with the crops at the right time. So there's the West, the Midwest, and then the Eastern stream. We are, of course, in the Eastern stream, and you'll see it typically starts, the season will start in Florida. They'll move up to Georgia, where usually their second location of a picking season. And at that point in time, they bifurcate either to Tennessee or the Carolinas, and then will commonly go all the way up through either the Virginias, or other groups will go up to Maine and then to New York, and then they'll come back. So that is a very traditional kind of seasonal sort of work that we see. In the southeastern stream, or the east stream that we see, they are primarily H-2A guest workers. We see predominantly Black and non-white Hispanic males. This is the stream that has the single largest need for services in other languages beyond English, so that communication does not become a further barrier. This is also the poorest of the picking communities in the United States. And based on some research we've done over the years there, about 67% of the people that we see in Bainbridge and Valdosta are themselves food insecure. And so if you just think for a moment, the paradox of that, the people who are picking our fresh fruits and vegetables are themselves very food insecure. That is a really disconcerting concept. We also know from other research that about 70% of the money that is earned each week is sent back to their family if they are living in another community or another country. So again, 70% of the money they earn each week. I wanted to show you a little bit, if you've never seen the work done in fields, it is interesting to watch. It's also informative to see the type of labor. And I want, as you'll see this, I'll tell you a little bit about afterwards. I want to point out that a lot of people would say this is unskilled labor, and that's actually not true at all. We'll talk about that again at the end.
The driver makes like $150 to $200 for every trailer. And the contractor gets 10 times more for using his truck. Also paid.
All right, so this video was taken in June one year, and so the average temperatures down there around this time of year are around mid to high 90s, really pretty high humidity. And the size of the buckets that the people that you see that are picking, they weigh about 35 pounds. And so that is 35 pounds that they are consistently putting up and over their shoulder and into that truck. The people who are picking in the fields are one level of the workers, and then you've got a person who's here, and what he is doing, even though you watched him on the phone, he is responsible for looking at those tomatoes. They are actively looking for a particular color of the tomato, and he will return a bucket if he doesn't like the color of them. And then what you may not have been able to pick up is he's flipping a coin or a token into that bucket that will then get pocketed by the person who's picking the tomatoes. And that, at the end of the day, is how they get paid. And so only when he accepts that 35-pound bucket does he put a token in it, and then the worker goes back and immediately repicks. What we will see are people are actually able to do these 35 pounds of buckets multiple times in 10 minutes. And so you can see the same person going back to that truck really commonly. It's different for larger tomatoes versus smaller tomatoes. And I've got some videos of that at the end. From an equity perspective, and here is a picture of someone picking smaller tomatoes, what we see are a lot of cultural issues, a lack of social support. Many of the people that we see in our clinics are here by themselves, or might be here with a cousin or an uncle, or maybe one person that they know. They form some form of social structure among the groups that travel together, but they are usually very isolated. Again, very food insecure, a very high level of poverty. They typically do not have transportation other than transportation that is provided to them to go to the fields, to go back to their housing units. And then once a week, if they're an H-2A worker, it is required that they have transportation to a location where they can purchase groceries. Additionally, their transportation every 6 weeks to the new set of crops will be based on the farm that they're going to next, if that's provided at all. There's very limited job security. So as we see climate change differences, as we see rules and policies about how people can work in the state of Georgia, the job security is very transient. There's a lot of mobility. There is a lot of concern with immigration status, both from the people that are working and who will ask questions, as well as a lot of concern for people in the community about why this group is here. There's a lot of otherism that we see, a lot of discrimination. And when we're there to hopefully provide some healthcare for them, there is a lot of confusion about the US healthcare system, what access they have, what their rights are, what they don't have access to. And that confusion is considered one of the largest barriers to their care. This is an older survey from 2011, 2012, but as you look at barriers to care across those who did answer this survey at that time. And these were very representative of the H-2A workers, but not at all representative of those who are not on an H-2A work visa. The cost of care is considered the biggest barrier, but inside of that is also a lot of lack of understanding or being unsure about what they would need to pay for and what they would not need to pay for. So cost of care is the bucket that kind of contains a lot of other misinformation or lack of clarification that we don't provide well. The Emory Farmworker Project, a little history on this. This began with one of our emeritus faculty members, Tom Heinlich, began this program in 1996. It was begun in a very small way he took some students down to South Georgia based on some relationships he had with the local health departments in 1996. And it was just enough students that fit in one car to go down there. These were students who were really interested in rural medicine. And Tom knew from his relationships with the health department that there was a very underserved patient population. He's an incredibly passionate supporter of this project and led it for its first 15 years. It has since developed into with his leadership, developed into a very formal academic service learning opportunity that is provided to all Emory physician assistant students. It is now expanded, which I'll talk about that in a second. On average, we see about 1,800 patients each summer in 2 weeks. And so it's not quite evenly distributed between the 2 weeks of Bainbridge and Valdosta, but you can imagine those are some very, very busy weeks when you're seeing close to 900 to 1,000 patients. We also go for one long fall weekend, usually in October. So we did that just a few weeks ago. I am also would like to point out to you that this is Emory's largest interprofessional education initiative, and that's something we're really proud of and something we're always looking for ways to expand, which we've been able to do a bit of in the past couple of years. So who are the Emory participants? And throughout some of these slides, you will see pictures of the clinics. So if you've never seen an outdoor clinic, this is a very standard looking site where we pop up tents and we caravan out there and everyone brings chairs. The students that are going to see patients also provide chairs for the patient they will see. Interpreters are there, they bring their own chairs, but this will be put up and taken down twice a day at different locations throughout the cities that we will be in. So again, this began in 1996 with the Emory PA program, faculty, students, and alumni. In 1998, the residents from this department, the Department of Family and Preventive Medicine, joined us. In 2008, the PT students, at the time they were masters of PT students, and now they are doctoral PT students. They join us typically just for a long portion of the weekend, but they come to both Bainbridge and Valdosta, and they come with faculty and alumni as well. They are a really incredibly important component of the care to be provided, given the very manual nature of the labor of these workers. In 2011, Rollins School of Public Health students and faculty began joining us. That has been an intermittent relationship of people coming down there, but there has been some thesis work and some different sorts of behavioral education work that's been done down there with the students to support the patients that we see. In 2013, the School of Medicine M2, M3, M4 students started participating. Again, that's been not consistent every year, although I think we've reached a fairly consistent space at this point. In 2021, a real dream of mine was to make sure we had all three of our Woodruff Health Science Center schools represented and able to participate if they wanted to in this program. And our School of Nursing students, the distance accelerated Bachelor of Science of Nursing students and faculty began joining us in 2021. And it's been a really rich engagement that has expanded what we've been able to do at the site. And I will brag about some of the work that they are specifically leading in a moment, but really excited to have that commitment. One of the reasons the School of Nursing students had never joined us previously is the School of Nursing does have a farm worker project that is uniquely theirs. And so we never wanted to take students away from an initiative that they lead, but the BSN students do not participate in that program. And so we were excited to have them join us in ours. In 2021, the Global Health Medical Residents also began joining us. And in 2022, we began some inroads to have this be a component of the MD PhD student curriculum at the time that the MD PhD students are in their PhD program, where they do have clinical time that they need to do. And we've received really incredible feedback for those students who've joined us this past year about this being a very intense time for them to remember their clinical skills while they're doing other sorts of work in their PhD program. And the ability to do this in a 80 hours in 1 week felt to them like a better way to hone their skills than doing a couple hours once a month throughout their program. So we're very excited about this relationship. So our educational partners, we are also very proud of the fact that while this is an Emory run program and an Emory supported program, we do have a lot of other university and academic centers in the state of Georgia and even some in Florida that participate with us. Mercer PA program is a large participant in this program. Valdosta State, when we're in that location, they bring their Department of Marriage and Family Therapy students, and it's incredibly important for us to be able to provide behavioral medicine support for the people that we see. Bainbridge College of Nursing, which now is renamed, but they have been a collaborator of ours for years. The Florida State University, in a couple different ways. Probably one of the most important ways with Haitian interpretation, which is incredibly difficult to find. They have a Haitian culture club and they come up and join us. The UGA medicine and PharmD students join us. Morehouse School of Medicine faculty are coming as they consider joining us as a collaborative partner. And then PCOM has also joined us. If you've never set up your own clinic site, here is a real, oops, sorry. Let me see if I can make that go back. Here is a quick look of what it looks like to set up just the dispensary or the pharmacy area of a clinic. And again, we will put this up, take this down in the morning and put it up and take it down again in a new location every single evening. Okay. So a little bit about what the clinic runs like. Most of you work in a clinic setting, and so this will sound pretty similar to you, but it's done outside in a field. So the patients check in. One of the components of the Emory Farmworker Project is that we are there as a collaborator and a guest of a local clinic, and that is the clinic of record while we are there. And so they do the patient check-in with the clinic workers and people that work for them full-time. And then they move through a vital station, which is done with the School of Nursing students. And then the PA, MD, or nurse practitioner students, the patient is then passed with an interpreter and their paperwork to that student. When we have students who are proficient in Spanish or Haitian Creole, they can then have that patient encounter without an interpreter. Otherwise, we make sure that there's always an interpreter there. And then we have a large cadre of preceptors. And don't worry, I'm going to ask you all if you want to join at the end. And all of our clinical students then present to the preceptor. Preceptors come over, see the patient. So it's a really incredible place to both provide care in a community that needs it, but also to be on site and practicing this full spectrum of care, the kind that you can do in a field with a clinical student, and to be engaged in the bedside teaching, but field site teaching for them there. Then we have a dispensary with some basic formulary of medications. We make sure we always have bags that every person who's seen gets that have condoms and socks and hydration messaging and things like this, toiletries, et cetera. And there's now a patient education team, which I'm going to tell you about in a second. And we also have a clothing area. This is what a typical clinic room would look like when you're at Emory Farmworker Project. So you've got the patient here in the back. And this is one of our former PA students, Erin Weems, an interpreter, and then not supposed to be in shorts, but here is a person who is in a DPT student who is engaged in this this clinic setting as well. And back here in the back, this is the dispensary, and here is the clothing off to the side. So some of the health risks that we see while we're there, and they vary in frequency, but it is really common for us to see work-related issues like heat stress, dehydration, musculoskeletal injuries. There's a lot of pesticide exposure as well, and that manifests itself in a couple different ways. We see a tremendous amount of diabetes, including new diabetes cases. However, I say that with the caveat of, because there is not a health record that follows these patients, we are not always positive that these are new diagnoses. They may be previously diagnosed but not treated, but we do see a lot of diabetes, and we are consistently talking about that. There's a lot of hypertension as well, asthma. The housing units are, I think by most people's estimation, would be substandard, and that leads to urinary tract infections, gastrointestinal diseases, a lot of foot fungus from the inability to clean socks and be in wet socks all day long. And then there's a pervasive amount of anxiety, stress, depression. There is substance use and domestic violence inside the housing units as well. These are some of the common complaints over the years. This has not been updated recently, but you'll see it's really pretty consistent what we see. The majority of people that we see will say, I am here because you're here, and I'm here because since you're here, I might as well be seen, but I don't have a complaint. Sometimes there is a complaint that is uncovered during a conversation, but a lot of times there are not a lot of complaints. And that is even with the type of work that's being done. And even if you're diagnosing someone with diabetes, they're still very hesitant to complain about anything. We see a lot of dermatological rashes, optimal eye issues of particularly pterygium, conjunctivitis. STIs are not uncommon. And again, this dehydration. And one of the reasons we see so much dehydration is, first of all, they're out in the field working all day long, but also the more you drink water, the more you have to go to the bathroom and the more time you're going to have to take out of the field. And that is a direct hit on their income. And so even though it is now a requirement by law in the state of Georgia that there is water and a bathroom facility on site, and it has to move with them as they move fields, there's still a very large reluctance to use those facilities. The patient education. This is a new component that has been, or an expanded component, thanks to our nursing colleagues. They have put together some really incredible resources on diabetes, heat and sun exposure, HIV and STIs, mental health, musculoskeletal, nutrition, etc. And all of these resources are now in English, Spanish, and Haitian Creole, and they all are printed or they are all on QR codes. And so people can take those resources with them on their phone as well. Another component of what we've done over the years at Emory Farmworker Project is currently on hold and went on hold at the beginning of the pandemic is Team Core. And I just want to talk about this for a second. This was the part that I led before I was the director of the whole program. This was a way for us to bring youth who were interested in medicine, social justice, or agriculture in the state of Georgia and the policies associated with that to the Farm Worker Project, and they were individually paired with a PA student. We tried to pair based on personalities and styles, and they worked as a unit the whole week long. And those teens generally came back multiple years in a row. And so it was very cool to see that they were actually more knowledgeable about the working style of a clinic than the PA students the first time they would be there. And so there was this really incredible teaching between the two, where the teens actually did have something to teach the PA students or the medical students. And then the PA or medical students also help those teens learn how to do a case presentation, perhaps even learn how to read an EKG. We've seen some really incredible presentations from these teens over the years. Most of the people who've been in this Teen Core program are now either in medical school, out of medical school, PA school, nursing school. A few of them have gone into law school. One is actually practicing as an immigration attorney at this point in time. And it's really amazing to see how this experience has helped inform. Of course, there's selection bias in that of those who choose to go, but it's been a really neat part of Farm Worker. We have some limited opportunities for scholarship that we've done over the years. And what we want to make sure that we're always really careful about when we do scholarship in this area is both that we have the approval of the local clinic and the health department, but also we are not there to do research on this population. If the research would benefit them and be something we could implement, we're supportive of that if we get approval, but otherwise, this is a population that is so remarkably taken advantage of on a regular basis. We do not want research to be an additional layer, and we don't want to be known for that. That said, we have done some work in the past that I think has been helpful for the communities that we serve while we're there. One of them is shown here on some of the on these pamphlets about HIV and HIV risk. And there was a lot of work done with some public health students about understanding cultural differences of interpretation of risk for HIV. If you live not with your primary partner, do you still have risk? Do you not have risk? And then how did they want to hear about that education? And so really helping the community engage in what they want to hear back from this research has been a concept we've tried to carry forward. Again, here's another video of the work, and I'm going to contrast this with another one in a second. This shows you a bit more of the field and the amount of people that are going up to the truck at any given time. There is another layer of field management of the person who's standing on top of the truck as well. And a couple of times you can see the guy who's taking the buckets putting a token in the buckets as they're coming down. But again, 35 pounds up and over your shoulder, all day long is what we're seeing a lot of. This is what I want to contrast it to. This is a sped up video of 14 people working for 10 minutes, picking small tomatoes, which do take more time. In that very sped up amount of time, which was 10 minutes, I don't think the whole thing played. We did not together combined fill this bucket. So all 14 of us for 10 minutes of time would have made a total of 75 cents during this work. So when people say this is unskilled labor, I would really suggest that that is not the case, and that is a lack of understanding of what's being done in the field. We have a lot of community partners that help engage in this work. They're listed here, but just to point out a few, there are federally funded migrant school programs. And so for a moment, if you think about, if you are a family and you have a child and you are in the migrant picking stream, you're moving every 6 weeks. And that means your children are likely moving with you. And so there is some work, it is very inconsistent across states, but there is work to keep children at the school level, if at all possible. Their grade level. As you can imagine, that's very, very difficult if you were moving every 6 weeks. So there is a summer school program in both of the locations that we go, that we have the privilege of going in and providing eye exams and some child visits as well while we're down there. We have a dental van as well that comes with us. And if we had to name one form of healthcare that we need more while we're down there, dental care would probably be the number one. We have so many people that are in need of this type of healthcare that the dentist can't do routine care. They can only do extractions while they're down there, and they will be busy for 8 hours at night doing extractions with 3 or 4 chairs at a time. And then the Runners Club in South Carolina, they have engaged in this program in a way that is just remarkable, and have created an entire system of collecting running shoes, running the dry wicking t-shirts you get when you do runs, and other clothing. And they come and do all the clothing work to provide to the communities that we see while we're down there. I think it's always important to point out, this is a really large program. This is several hundred people a week that are down there. This is a multi-$100,000 program a year, and it is primarily done on fundraising. So Emory PA's program's board review course has been our primary source of funding for this program, but our students do a 5K run. They do bake sales. They have a class cantina where they sell snacks, and they sell t-shirts. And this is the way we fund this project every single year. Here's an unabashed plug to ask you if you'd like to join us. We would love to have you. We are doing something different this year. We are going to, normally we go to Bainbridge for a week, and then we immediately go to Valdosta for the following week. But this year we are splitting them up. Valdosta will be in May, and June will be when we'll go to Bainbridge this summer. We're doing that for the reason that the workers' season in Valdosta is now appreciably different than the working and picking season in Bainbridge. And we are missing a bunch of the people we would like to provide care for if they want it in Valdosta by coming in June. And so we're going to trial it out this summer, and we're going to move it up into May when the majority of the camps are still open there. This is a real product of warming in our state, and how the crops have changed. What can be grown and when they are grown is really shifting. And we need to make sure that, our primary goal is to be there to provide care for communities that have very, very little access to care. And so we have been very grateful to our clinical team who've said, yes, we can make that work, because we need to actually remember why we're going, which is to provide the care, and we need to be there when the patients are there. And then we try very hard to remember that and to talk about this program, that when people push back about why we would want to do this, we really need to remember that all of our health is based on the health of all of us around us. And while these are commonly unseen groups of people who are working in our communities and in our state and providing services that all of us benefit from, their health matters. Their health matters to them both personally, but also matters to our larger community. And so we talk a lot about this with our students, and we try to talk a lot about this with the community colleagues that we have down in the areas where we work, and feel really strongly that this is one of the taglines of why we do the Emory Farmworker Project. So with that, I would love to answer any questions that you have about the project, the work we do down there, the things we've seen, the things we've done well and not well, anything you would like to ask.